Questions to the Minister of Health. Questions 2 and 7 have been withdrawn, and I call Patrick McGlone to ask the first question.
Question number 1.
Thank you, Mr. Speaker. I'll join question 1 with question 14 and ask for maybe a bit of additional time. Special recognition payments of the health and social care statutory sector employees were paid in July. And I've said previously, delivering this to those employed in the independent care sector has proven to be a complex and more challenging issue. I can confirm that progress is being made in relation to making the payments to those who work in the independent sector. On the 29th of October, a letter was issued to all independent sector care home and domiciliary care providers who were registered with RQIA, inviting them to identify their qualifying employees. The letter provided details of eligibility criteria and how the employer should claim on behalf of their staff. Further to the initial letter on the 29th of October, my department wrote out again on the 12th of November to provide some additional clarity regarding the data required to be shared, taking into consideration recent data protection advice. Employers are required to complete and submit claims no later than the 30th of November, and as expected, the payments will be made by the business service organisation within a maximum of 4 weeks of receipt of a verified claim, and that's accompanied by the correct background documentation to support the payment process. Where staff work for an independent care provider during the qualifying period, whether for the full qualified period or in part of it, it is that provider's responsibility to ensure a claim is submitted and to make subsequent arrangements to pass this payment on to the relevant individual. As of this morning, I can confirm that 247 claims have been submitted to the Payment Shared Services. 129 already have been opened and are progressing through the various stages of prepayment checks. And this figure has included 46 suppliers that have responded to the Payment Shared Services request to submit sample P60s. Of those suppliers, already a payment has been made of £1,041,855.39, and that will be included in recognition of 1,675 individual employees. Mr. Speaker, I remain personally committed to ensuring the recognition payment will be paid to the independent sector staff as soon as is practicable.
Patrick McGlone, supplementary.
I thank the Minister for his detail, but can the Minister give us an assurance that after 10 months now, that those people who have been waiting that protracted period of time for working through this machinations of whatever it is, that they will get their payment before Christmas?
And as indicated, can I say just in regards to the 10 months and the machinations that the member refers to, from initially being announced, I then had to make a bid to the Department of Finance for the monies. There was then additional queries and requests come in to make sure that the £500 was not susceptible to tax liability. So we worked again through HMRC, through the Department of Finance. That guarantee could not be provided, so that again initiated another bid to the Department of Finance to make sure that additional monies were actually paid to the employers, so that the recipient would receive as near to the equivalent of the £500 as possible. So that's where a lot of the time was actually taken in regards to that, but also in regards to the payment processes to the independent sector. It did prove more complicated than originally envisaged, and also in comparison to our own staff as well. But in recognition of that, we have already started the process. And as I indicated earlier, there's already 247 claims have been submitted, and we have already paid out more than £1 million. So the time frame in getting that into individual pay package depends on the data coming forward to us in a reputable and reconcilable format, because this is subject and will be subject to audit purposes. So as soon as we get the information, we are processing claims.
Call Paul Frew.
It seems to be the case that healthcare staff will be disadvantaged because of their shift patterns. Can I ask the Minister if he could outline if the £500 payment reduces if the department deems workers have not worked what the department classes as full-time? If that is the case, what does the Minister deem as full-time?
The £500 has always been indicated as a pro rata payment in regards to the number of hours paid, and that's what makes the submission of claims from the independent sector that bit more challenging, because those who are working within the health and social care systems, we have timesheets, we have the ability to verify that data ourselves, so we do require that additional data to come forward for the independent sector so we can verify the spend, the payment, which is public money. So it is a pro rata for the £500 equivalent is the equivalent for a full-time employee.
Caroline Cullen, call Caroline Cullen.
Gormelka Cancolia, and thank you, Minister, for your responses, and thank Patsy McClone for putting the question. And Minister, you have already alluded to the fact that HMRC have already made their call in terms of tax, and I'm sure you'll agree with me, HMRC is not too slow in taking the money out of our pay packets, but very rarely, gives it back. Can the Minister, he's already given some figures, but can the Minister try his best to press upon his officials to get this payment made before Christmas, which is, I'm not counting, but I'm just going to say it's 33 days. A lot of these women working in, a lot of people working in this sector are women and they're low paid, and I'm sure they appreciate us all doing everything we can so they can get that payment. Thank you.
No, and I thank the member, and it was frustrating in regards to the taxing and the having to pay national insurance and HMRC on this £500. It's actually something that was raised by both the Scottish and the Welsh administrations as well, and I know we did get support from the Minister in Finance in putting that ask forward. In regards to getting this money out, as I said in response to Mr McLowan, we already have over £1 million paid out in regards to payments and applications that came forward. So as soon as people can get that verified data to us, we will process it as quickly as we possibly can, but always taking into consideration, and I know the member said there's 33 days left, there may be an opportunity for 2 pay packets in regards to that, because the December one, for those who are monthly paid, always comes earlier, so we're doing our best to meet those commitments as well.
Call Pam Cameron.
Thank you, Mr Speaker. Thank the Minister for his answers so far. Given the pressures that are on the healthcare sector, in particular in domiciliary care, and the pressure that's on hospitals to actually release people into their own homes on the back of care packages, will the Minister give a commitment to all those workers from supported living and domiciliary care sector that they too, even though they may have moved on to other areas of employment outside of the health sector, even though they have their qualifying period done through the pandemic, will the Minister give assurance that those people will feel the value of receiving their recognition payment, and if so, when will that process begin?
The member, and again, this is the challenge for people who have either changed employers during the eligibility time period or had worked for one employer through the eligible period and now are working with another period, is how we get that cross-reference of identification and who's actually applying for the payment. So that is becoming more challenging. Will they be part of the second tranche? I can't guarantee they will be paid before Christmas in regards to the gathering of that information, but again, we are working with trade unions, with employers, to make sure that we get as seamless a possible process to make sure that they capture the data so it is auditable as well, because we are conscious again that this is public money, but we want to get it out to as many people's pockets as we possibly can as quick as possible.
Steve Egan.
Okay. Thank you very much, Aidan. May I thank the Minister for his answers so far. While we welcome the steady progress that has been made in issuing these important payments, can the Minister provide an update on how many claims, in addition to the independent sector, he expects will be received from contractors such as GP practice, dentists, pharmacists and opticians, please? Thank you.
And I thank the member for that question, because again, although most of the questions has been on the independent care home sector, that sector counts to over 1,500 individual employers as well, which we expect to receive claims from. We've already received 145 valid claims from that sector as well. So again, encourage those employers to get as many applications in as soon as possible so we can get them processed as well.
Paula Bradshaw.
Thank you, Mr Speaker. Minister, just going back to the question that Pam Cameron just raised there, I have a constituent who has since left the place of employment, and she's been told that her previous employer is not going to apply on her behalf. Is there a recourse for people who find themselves in those sorts of dispute? Thank you.
And I thank the member for that point, because it is something that we will be getting a number of queries on in regards to those individuals as well. In regards to the initial employer not making that payment, there is no reason why they shouldn't apart from their own willingness to do that. That would be our preferred way to do it, because they hold the actual data as to how many hours that person worked, where they worked, and actually how much they'd be eligible for as well. So it should be the application process should be through the original employer. I'm also made aware of in some small number of circumstances, because an individual actually left their initial employer, it's almost out of spite that they don't want to make those processes. And I would say to those employers, please don't, because those individuals did work for you during the qualifying period, and they are entitled to this payment as much as those who are still working for you as well.
I call Alex Easton.
Speaker.
I thank the member for his question. The South Eastern Health and Social Care Trust, which is responsible for Bangor Minor Injuries Unit, has advised that the consolidation of the Bangor and Ards Minor Injuries Units on the Ards Hospital site remains under continuous review as part of the Trust plans for rebuilding services. However, due to the ongoing impact of COVID, the Trust is not able to provide a definite date for the reopening of Bangor Minor Injuries Unit at this time. So despite being unable to confirm when the Bangor Minor Injuries Unit will reopen, the Trust has provided assurances that patients are continuing to receive appropriate care in the Ards Minor Injuries Unit, and feedback from patients has been favourable.
Alex Easton, supplementary.
Thank you, Mr. Speaker, and thank the Minister for his answer. Minister, the reason why I raise this, and have raised it on numerous occasions with you, is my deep concern at the levels of patients attending the accident and emergency in the Ulster Hospital. It's continually overflowing. We have the situation where GPs are sending up people up to the NEs where they would have maybe seen them in the past because of the COVID crisis.
Member, move to a question, please.
So my question is that does it not make sense to reopen the Bangor Minor Injuries and take the pressure off the Ulster Accident and Emergency Department?
And I thank the member. The South Eastern Health and Social Care Trust has informed me that they have analysed the data regarding the attendances from the Bangor area postcodes at the Ulster Emergency Department, and there has been no increase following the consolidation of the Minor Injuries Unit actually in Ards. So the South Eastern Trust has done that piece of work, but the Trust is confident that patients are receiving an effective service and have received some very positive feedback in regards to the service at Ards Minor Injuries Unit. It is nurse-led, and its emergency nurse practitioners provide expert advice to ensure that clinical practice and patient care is delivered to the highest standards, and are accountable for assessing, diagnosing, advising, treating and discharging patients and providing high care quality specialist care. The type of injuries that are being completed under the Minor Injuries Unit at Ards include cuts and grazes, sprains, strains, sports injuries, limb injuries, bites, stings, burns, and the removing of foreign bodies from ears and eyes and noses. And up until this month, the Ards Minor Injuries Unit is treating almost 1,500 patients per month, so the consolidation of those two units is still covering a large number of patients.
Call Colin Gildernew.
Minister, over recent weeks there has been significant and worrying increases in pressure on a range of emergency departments at the Royal, Craigavon, Antrim, Galvin, Enniskillen and the Ulster hospitals. Can you confirm, Minister, if minor injury unit hospitals have also experienced similar pressures?
In regards to receiving additional pressures, they are seeing an increased number of people presenting to them, and those people are getting turned around actually quicker if they go to be seen in the right place at the right time. It's also something we're actually seeing from the introduction of our Phone First model as well, which has been rolled out across a number of departments as well as a part of a response to no more silos as well. So it is about making sure people are directed to the right place at the right time to be seen, and I think that is the challenging part that we actually face in regards to utilisation of health in general, especially as we enter a busy winter period as well. So I'd encourage people to make sure that they do access health services at the appropriate place at the appropriate time, and help us to look after them.
Call Alan Chambers.
I certainly look forward to when circumstances can facilitate the reopening of the Bangor Minor Injuries Unit, but in the meantime I would commend the work of the Ards Minor Injuries Unit. Would the Minister consider coming with me one day to visit Bangor Community Hospital, to meet with staff and to hear of the many services it very effectively currently provides? Thank you.
I thank the member for his kind and public invitation, and the fact that it is kind and public, I can hardly say no. So, yes, I will.
I call Kelly Armstrong.
And thank you, Minister. Minister, I would like to pay tribute to those in the Ards Minor Injuries Unit. I just hope their leaking roof gets fixed soon. But when we're talking about reopening, Minister, I've asked you before about day centres and respite care. They're still not fully reopened. Carers are exhausted. Is there any update on when they will be opened by the trusts fully?
I thank the member for her question. As she will know, this is something that I do know it's dear to her heart and it's dear to my heart as well. The Chief Social Worker has, I asked the Chief Social Worker to review, along with the Public Health Agency and RQIA and a number of other agencies, and how we can open up those processes and places more safely in regards to that, and I expect an announcement to be coming in the coming weeks in regards to that. But again, I'll keep the member up to date because I know it is something that she has continued to press on and she has a particular interest in.
I call Matthew O'Toole.
Question 4.
I thank the member. According to the latest statistics in June 2021, 93.4% of patients received their first definite treatment within 31 days of a decision to treat. In this context, treatment can mean surgery, drug therapy, radiotherapy, specialist palliative care and active monitoring. There is, however, no doubt that despite the incredible effort on our frontline workers, the current extreme pressures on our hospitals are already having an impact on the system's ability to deliver planned surgery. Clinicians in Health and Social Care Trusts will continue to prioritise time-critical patients, and available capacity will be allocated on a regional basis to ensure that patients from across Northern Ireland have equity to access to surgery. So whilst we continue to try to protect elective care as much as possible, the stark increase in hospitalisations has undoubtedly seen an impact on delivery, and it is expected that surgical capacity will continue to be constrained for as long as this level of pressure persists.
Supplementary, Matthew O'Toole.
Thank you, Mr. Speaker, and I thank the Minister for that answer. Minister, I agree with you that one of the reasons we need to manage COVID pressures on our hospitals is the pressure that it puts on cancer care. Can I ask the Minister, does he or his department have any data on how many patients have required more complicated treatment or indeed have suffered from reduced life expectancy as a result of delays in treatment as a result of COVID? And would he also agree with me that for those who don't think that we need to reduce pressure on our hospitals, they should go and say that to people who are awaiting cancer care and tell them that their procedures aren't vital?
I thank the member, and I have, since coming into this position, I've repeatedly said that the pressures that we're currently seeing aren't solely being caused because of COVID, but they've been highlighted because of COVID. The pressures that we're seeing across our health and social care system are due to 10 years of underinvestment in regards to both the structures themselves, but also our workforce as well. In regards to making sure patients are seen as effectively and as efficiently as possible, I did announce and produce the elective care strategy back in June in regards to a number of additional steps that can be taken, that are being taken across the region in regards to our reprioritisation organisational group that look at waiting lists across the entirety of the region rather than simply based through trusts. And that elective care framework does put out different scenarios and different procedures in different locations that we are doing to keep those COVID light sites as open as effectively as possible, but also the initiatives that we're putting into our waiting list initiatives as well in regards to the additional funding that we have got in place that can support additional services either in the independent sector or in other places as well.
Maria Flynn.
And Minister, just given the pressure that the system is under, particularly in relation to cancer healthcare, which is obviously time critical for a lot of people, can the Minister confirm if any patients have been referred to other jurisdictions for treatment, either via an ECR process or a healthcare directive?
I thank the member for a point. I don't have those specific numbers with me, but what I can update the member in regards for our waiting list initiative programmes that we have taken forward, and the member will be aware that has been based on different monitoring round bids. Just shy of 81,500 people have received additional elective activity outside our normal services in regards to services that we've been able to provide either by additional payments and trusts or through GP federations or in the independent sector as well. So we are using every available resource that we can and utilise at the minute. Our health and social care consultants continue to utilise our local independent sector theatres, that's both in UIC and Kingsbridge, to ensure that those priority patients can be treated as well. And we're also looking to utilise even resources in the Republic of Ireland and elsewhere. But what the member, I'm sure, is realised and was part of the earlier debate as well, that COVID just isn't solely happening in Northern Ireland. So when we look to those additional capacities that we could buy outside Northern Ireland, a lot of those are being taken up by those regions in themselves.
Rosemary Barton.
Thank you. Thank you, Minister, for your answers so far. Minister, you spoke earlier about elective care. As you'll know, there has been an initiative in the South West Acute Hospital in relation to elective care surgery. Can you comment on the success or otherwise of that, please?
I think what the member refers to now is what we've seen, especially over the last 18 months, and that's about looking at our operational ability across the entirety of the region, where we're looking at that regional prioritisation operation group coming together now on a weekly basis, looking at the long waiters, those most in need of critical time period or time pressured surgeries as well, that we are getting them seen and operated on as quickly as possible. So we've looked at a number of different initiatives across Northern Ireland, and especially at one point where we were actually seeing Belfast surgeons operating in the SWA in regards to making sure we were getting the maximum utilisation of those theatres as well. We're also looking at the additional capacity and utilisation that we may also use Noma Hospital too, to make sure we're using and getting the availability of every square foot of real estate in the state that we have across Northern Ireland.
John Blair.
Thank you, Mr. Speaker. And can I ask the Minister if he agrees that taking steps beyond merely voluntary vaccinations, such as prohibiting high-risk venues from opening without mitigations, would reduce coronavirus infections and COVID-19 hospitalisation, and therefore would facilitate refocus on waiting lists? That is why new actions have been identified, and that's why we should stick to them.
I thank the member, and he'll be aware that that is a conversation that is ongoing in the executive in regards to the utilisation of COVID certification, and I think Mr. Speaker will be part of a wider debate at another point in regards to the utilisation and where it comes in and where it can be of benefit elsewhere.
John Bunting.
Please.
And I thank the member for her questions. As members will know, the need for enhanced infection prevention and control measures in dental practices includes the need for follow time between appointments, and that has resulted in practices operating at around half of the activity levels seen prior to the pandemic. Dentists are prioritising patients requiring emergency or urgent care to ensure that this more time-limited capacity is targeted appropriately. If a patient is not categorised as high risk and has a diet low in sugar, no history of dental disease and good oral hygiene, they would be judged as low risk and can safely wait for a longer period of time for a routine appointment. Patient registration timeframes have been extended to ensure that nobody becomes unregistered because they cannot access their dentist due to the pandemic. The General Dental Financial Support Scheme has helped to ensure the sustainability of general dental practices during this uncertain period. At the same time, a network of urgent dental care centres was established across Northern Ireland, and that was to cater for those patients who, for various reasons, could not receive dental care in general dental practice. And as a result of both initiatives, patients with pressing oral health continue to receive vital health care. So whilst the picture varies across Northern Ireland, practices have largely dealt with those patients experiencing symptoms and are now in a position to offer appointments for check-ups and routine treatment. In addition, in February this year, I provided a further $1.5 million to help improve patient throughput at dental surgeries throughout Northern Ireland, and that funding helped practices reduce the follow time between patients by investing in improved ventilation or through the purchase of high-volume suction devices. Revisions of the UK Infection Prevention and Control Guidance are currently the subject of a review, and the proposals may increase the capacity in a practice by a small amount, but my expectation is that unfortunately activity will remain unavoidably impacted for many months to come. In June of this year, I established the General Dental Services Rebuilding Stakeholder Group, which provides a focus and momentum to addressing the challenges facing the sector in the coming months and years. That group includes the representation from the British Dental Association and continues to explore ways to increase capacity within the sector so that practices can see more patients. It's also important that we continue to review our treatment priorities to ensure that we are using the available capacity in the best way possible. I met with the BDA on the 21st of October to discuss these issues and the ongoing challenges facing patients. My resolve and commitment to rebuilding dental services and improving access to patients remains.
Joanne Bunting, supplementary.
Thank you, Mr Speaker, and I'm grateful to the Minister for his answer. However, the nub of my question is if there's any amount of private appointments available but none for NHS patients, and the Minister will be aware that I've got a number of questions pending on this. I'll cite the example of one elderly constituent whose family had to ring 10 dentists across numerous constituencies, none of which were accepting NHS patients, including transferring ones, and the only way this person was able to get an appointment was by accepting a private one. Now, we know that poor dental hygiene has an impact on poor health, so does the Minister recognise the full extent of this problem, and does he accept that expedient action is required before dentistry is the next crisis and beyond the affordability of many?
And I thank the member for her point. I don't know if she has written with that specific constituency case to me, but I'm happy if she does want to indicate it with me, because most dentists in Northern Ireland spend part of their week doing health service work and part of their week doing private work. And one of the conditions of our financial support scheme for health service dentistry is actually that dentists maintain their pre-pandemic health service private split during the pandemic. So dependent on the current relative demand for care from health service patients and from private patients, it may be that within a given practice, waiting times are longer for health service care than for a private care. It is therefore possible that a dental practice with high demand for health service appointments but low demand for private appointments has longer waiting times for those health service slots and much shorter waiting times for private slots. I can assure the member that the Department of Health and the Health and Social Care Board advise dentists to prioritise patients based on clinical need, with patients in pain being high priority cases. And in regards to that is the conversation and a supportive position that between my department but also the British Dental Association as well. But in regards to the specific case, if the member is right to me.
Con Nicola Brogan.
And I thank the Minister for his answer as well. In my former role as manager of a dental practice, I'm acutely aware of the pressures that dentists and dental staff face, particularly throughout the pandemic, but I also know the importance it is for people to get access to dental care quickly. So can the Minister outline where you've sought to source temporary capacity to address the pressures on NHS dentistry in particular?
And I thank the member, and she will know from her previous role that the amount of additional capacity is not the same as we have within the independent sector, within other health provisions as well. So it is about working with the British Dental Association and dentists as well as to how we can actually support them to increase the amount of work that they are doing internally as well in regards to not just the reduction of follow time but also the utilisation of the 1.5 million support payments that we gave early in February to help practices reduce the follow time actually by improved ventilation and through the purchase of those high volume suction events. So the conversation that is ongoing with our newly appointed Chief Dental Officer, myself and the BDA is about how we maximise the capacity within our current dental provision.
Daniel McCrossan.
Mr Speaker, and I thank the Minister for the answers to the question so far. Minister, how swiftly do you intend to conclude this review with dentists and ensure they have adequate funding to survive going forward? Thank you.
I thank the member, if he's talking about the dental contract, the member will know that has been an issue now for the past decade in regards to the working between my department and the British Dental Association. I am hopeful that we can move to a very swift resolution, but I doubt that the level of negotiation and contractual engagement will not be possible before well, this side of an election, but it is work that we have commenced and working in that partnership again with the British Dental Association and dentists as to how we actually prioritise the work that we need to be doing as a Department of Health and supporting our National Health Service patients, but also make sure that we have, as the previous questioner asked, to make sure that we have a dental service going into the future as well, because we are aware of the pressures that they're currently under too.
And that ends the period for list of questions, and we now move on to 15 minutes of topical questions. And I call Paula Bradshaw.
Mr Speaker, Minister, you responded to an Assembly question recently when I asked you for a breakdown of the £12 million that you've given to the social care sector for the winter. It was mostly for PPE, hygiene control measures, etc. I'm just conscious that the domiciliary care sector has never been more vulnerable and had more vacancies. Is any more money coming forward to actually prop up the service? Thank you.
I thank the member for that point in regards to the support of our domiciliary care workers, both in support, recruitment and retention, because it is a workforce that's actually not just under pressure in the work they're doing, but also the numbers as well. The member will be aware that that's why I established that Fair Work pay forum as well for the independent care sector. That has currently now met. It was chaired by the Chief Social Worker within my department, but one of the things that we have identified is actually the appointment of an independent chair who will come in and look at that overarching piece of work. We are currently working, and I announced it last week, we're actually looking at a number of options where we can provide additional financial supports to the domiciliary care sector, and my intention would be that those additional financial supports actually go directly to the workforce.
Paula Bradshaw, supplementary.
Thank you, Minister, for the work in relation to this. I suppose when I speak to people in the sector, not least those who manage the home care packages, you know, they want to train their staff up. They want them to be the eyes and ears going into the homes and being able to then report back to GPs, for example, if they think people are fragile on their feet. What work's being done in terms of a more integrated health and social care service here in that regard? Thank you.
And again, the member raises a valid point, and we think, you know, well, we saw that during the pandemic with those in-house or in-reach hospitalisations where we had GPs and actually hospital consultants actually reaching into our care home sector as well in regards to the medical advice and supports that they could give as well. That's something that we actually want to build upon. It's something we saw as being useful and supportive. One of the biggest challenges that we see in a care home with many residents, we often get many GPs as well supporting their individual patients. So if there was a way, and something we're looking at is how we streamline that interaction to, rather than seeing a number of GPs supporting the home, whereas we could get a more focused approach, and that allows then a consistency of care. But it also looked to how we actually work primary care with secondary care and make that connection with the care home and the people working in it as well. So there is a more integrated approach and support package and mechanism for the people in our care home sector.
Well, Pat Cataney.
Thank you, Mr Speaker, and thank the Minister as well for being here. Minister, could you provide an update to the hospitality sector on the practical implications of the COVID certification scheme, in particular the operation of the lateral flow test?
I think in the time that the Speaker would allow me to answer this, I don't think I can get into that detail, but I will update the member that there has been engagement between the Executive COVID Task Force, who are actually leading that piece of engagement work with the hospitality sector. They met with them last week. I was told this morning they're meeting with them again today, and as the regulations draw out and actually come to a firm position, that engagement has been had with hospitality, not just Hospitality Ulster, but also the Hotel Federation, as well, as to listening to their concerns, but also seeing how this could be actually practically utilised as well. In regards to the point, and I think it is a point that was made actually in the earlier debate, that this isn't solely about COVID certification. There's the option of lateral flow devices, but also the proof of having had a positive PCR within the last 30 to 180 days as well. So it's not solely about the focused utilisation of vaccination, which many seem to be focused on since last week, either deliberately, mischievously, or to prove an ideological point that they have already taken a stance on.
Pat Cataney, supplementary.
Indeed, Minister, I have to agree there with your last part of your answer to my question. But, Minister, could you ensure that there is robust now, robust communication about the implementation of this scheme. It must work and will provide safety, but community support and buy-in is essential, and a clear communication process is essential.
I would agree with the member. This must work, and again, communication is essential, and that's why it's particularly frustrating that many of the conversations that are being had in the general public, but also in the media, are being taken on behalf of papers that were partially leaked in regards to what was being discussed and what was being talked about, and that even continued up until this morning in regards to even prior to the executive met at 9:30. So it's not a conducive way to do business when partial information gets put out to establish part of a position that individuals have already taken a position on.
Paul Trevor Clark.
Thank you very much, Mr. Speaker. Minister, we are all aware, acutely aware, of the difficulties you face in terms of your portfolio with health and indeed the pressures that the hospitals are under. But can you indicate the number of people who are actually waiting to leave hospital, who are waiting on domiciliary care or indeed any other form of care to actually allow them to exit hospitals?
I don't have the exact figure for today's numbers to date, but I know it is in the region of often in regards to 300 on a daily basis that are waiting on that assessment to leave. And again, it goes back to an earlier question that was asked in regards to the availability of domiciliary care packages. We've also supported in regards to that, or in lieu of that, is care homes actually taking patients as a step-down facility, whereas in the past, after 6 weeks, the care home would actually have charged for those positions. We've actually waived that now, so if people do seek that as a step-down facility, there will be no charge applied to the family, so that we can actually utilise the throughput of patients from the hospital bed actually back into the community as well. There's many challenges in regards to the low number of workers in the community domiciliary care package, and what we're actually seeing is since decisions were taken in regards to Brexit, we have seen that workforce actually decrease as well. Whereas, and it's a concern that has been shared with your own minister, Indira, in regards where the husband, the son and the father was working in the food processing sector, the mother, the wife, the daughter was actually working in the domiciliary care sector as well. So there was a double hit on our available workforce as well. But as I said to the member earlier, in regards to, we have established a number of support mechanisms and are looking at ways to enhance that current workforce so we can keep them in place.
Trevor Clark, supplementary.
Mr. Speaker, and thank the Minister for his answer. Minister, I visited an establishment in my constituency in Ballyclare just over a week ago who can accommodate 7 patients, and there's 5 of those beds are vacant. And they're telling me the reasons those are vacant is because the people are blocking beds in hospital, and there's nothing to prevent them, or sorry, there's nothing in place to prevent even in that one facility alone 5 patients leaving hospital to get to that facility. So can I ask the Minister, will you take a serious look at what can be done in the short term to try and expedite the opportunity for these people to get out of hospital and to allow the capacity to remain within the hospital to treat people who are now at this stage very seriously ill, and these people are now waiting to get out of hospital as well?
No, and I think the member has a valid point. Actually, my department and the Health and Social Care Board wrote to all trusts as late as last week, again reinforcing that exact position. The difficulty that we do encounter, and it's a phrase that used to be referred to, Mr. Speaker, was those of bed blockers. What we're actually seeing now is families and even elected politicians now getting involved, where they're telling patients not to leave a bed, or their families advising them not to leave a bed until there's an enhanced or suitable care package in place. And on many occasions, the facility that the member talks about may be that step down that the health and social care sector actually needs, that the patient would go there first as a step down facility, while that entire care package was actually sourced and put into place as well. So I'd encourage as many members to support the health service as well, as we get those seamless transfers from hospital into the care home sector or back into their own homes as well. It is a challenging time in regards to what we're actually seeing. Unfortunately, it's not new to the health service in Northern Ireland, but it is something that we're working to address in regards to how we actually support that sector, which has been largely forgotten about and largely kept in the dark in regards to workforce and who was actually working in it.
Stuart Dixon.
Mr Speaker, thank you, Minister. Minister, you'll be aware of the difficulties that your department had back in the early part of this summer in delivering the COVID travel passports, but that seems now to be behind us and the system does appear to be working. Similarly, it appears to be working for the domestic COVID passports as well. Can you tell us a little about the resource which the department is putting into the technology behind both of those applications?
And I thank the member for his question. In regards to the first international COVID certification, the first development we made, it had to meet not just the requirements that we were looking across the United Kingdom, but also EU and World Health Organization data in regards to make sure that if it was being used as an international travel pass, that it embedded all the security measures that were needed to meet all the requirements on an international basis that had been agreed. That included the second vaccination, the data, the security there as well, but also that it couldn't easily be counterfeited. And if the member has downloaded the international pass, he'll see that it's a 2D barcode. There's a reflective hologram there as well, and it carries data that's necessary for the international travel pass. In regards to the domestic one, which we launched at the start of the year, through interaction with the Information Commissioner's Office and other bodies as well, it was deemed that that level of information should not be accessible to anyone who required to receive it on a domestic setting, and that's why the domestic certification carries the 2D barcode, a photograph and the holographic HSC logo as well, so that screen grabs can't be taken, they can't be passed from one individual to another. So there's a high utilisation of using information behind that information technology to make sure that they're not easily abused or abused in regards to their primary utilisation.
Stuart Dixon, supplementary.
Thank you. I appreciate the work that the Minister's Department have put into this. But, Minister, there is one issue that's a recurring issue for me and for many of my constituents, and that's where they received their vaccination either in Northern Ireland, the Republic of Ireland, other parts of the United Kingdom, or indeed overseas. I have one constituent who received one vaccination in Canada and another here in Northern Ireland. It appears, technically, at the moment, impossible for them to get the full international travel or indeed domestic passport because of where they received their vaccination. One jurisdiction, one in another, just doesn't seem to match up. What is the department doing to deal with that anomaly? And it is now of extreme urgency, given that many people will wish to download a domestic passport but do require proof of 2 vaccinations, and indeed going forward will need proof of a booster vaccination.
I thank the member in regards to that. In regards to the having received one vaccination in one jurisdiction and the second in another, that issue should be largely resolved. If those who are applying, if they go on to the NI Direct website where they apply actually for the COVID certification, I think it's the second screen. If you go down a bit, there's an application where you can actually ask for a letter of proof that you have been vaccinated in a different jurisdiction. It's a more manual process because there's a dual, it's not an automated process, to match those two together to actually produce the certificate. But there is a process there. I'm happy to talk the member through it and give him an explanation later, because that process is still there. When it comes to international second doses, as in Canada, that's not just as seamless a process as is whereas the second dose has been given within the jurisdictions within the United Kingdom, whereas we can verify certification. So that's not in place yet, but it is something that has been worked on.
Call Rachel Woods, and the member may not have time for supplementary.
Thank you, Mr Speaker. Can I ask the Minister for an update on the commissioning of abortion services in Northern Ireland?
I thank the member for the question. The Abortion Services Direction 2021 came into force on the 23rd of July and required my department to have commissioned abortion services in place by the 31st of March. That includes requirements in relation to the provision of information, contraception and the provision of a regional telephone-based, non-biased advice and referral service, all of which are elements of the ongoing planning work and will form part of an overall draft service specification. The draft service specification will be subject to approval by the Executive in due course, and is expected that a draft service specification will be completed and issued to the Executive in early 2022 for approval. As I stated previously, under the Ministerial Code, I am required to bring any matter which is significant or controversial and clearly outside the scope of the programme for government to the Executive for consideration and agreement.
Time's up. And members, take your ease for a moment or two, please.